Hello everyone, this is Dr. Sushmita and it's so good to see you all here again. The product for today's discussion is Waldent Electric Pulp Tester. But before starting the video, make sure you like and subscribe to our channel and press on the bell icon to get new video updates. So without further ado, let's get started. Waldent Electric Pulp Tester is a device used to examine the vitality of the dental pulp using the electric stimulation. Waldent Electric Pulp Tester comes with a main unit, 9V alkaline battery, 4 lip clips, 2 test electrodes, 1 test cable and a user manual. The test electrodes and the lip clips are autoclavable as they are made of stainless steel to avoid infection. On the top there is a hole for attaching the test electrode. On the right side there is a jack for attaching the test cable where the lip clip will be connected. Power and mode button is present on the left side and the test results are visually displayed on the screen. It has 3 modes: high, medium and low. Explain the test procedure to the patient to reduce patient's anxiety as it can result in giving false reading. Isolate and completely dry the tooth or the area where the test need to be performed. Then check the proper functioning of Waldent Electric Pulp Tester before using. Before performing the electric pulp test on the required tooth, perform the electric pulp test on the control tooth. For example, if the test has to be performed on 3-1, perform test on 4-1. And if the test has to be performed on 3-6, first perform the test on 4-6. That is, the same tooth on the same arch but on the opposite quadrant will be the control tooth. Apply an electrolyte, it can be a prophylaxis paste or a toothpaste on the test electrode and place it against the dried enamel of the required tooth. The placement of test electrode for the incisor teeth is on the incisal third, for the premolar it's on the buccal cusp and for the molars it's on the middle third of the mesiobuccal cusp. Then complete the circuit by placing the lip clip on the patient's lip or ask the patient to hold the lip clip with their bare hands. Turn on the device and select the mode to introduce minimal current onto the tip. Ask the patient to tell when they start feeling the toothache or tingling sensation by raising their hand and stop immediately to record the reading displayed on the screen, as this figure is tooth stimulation current reaction number. To the reading. The value between 0 to 40 means the tooth nerve is vital. The value between 40 to 80 means part of tooth nerve is non-vital. And when the numeric value has reached 80 but the tooth has no reaction, then the tooth nerve is completely dead. So that's all we have for today. Thanks for watching.